Welcome, everybody. It's so nice to have you all here discussing a very important topic, and especially this month because it is National Caregivers Month. So happy National Caregivers Month to everybody. Thank you for joining us. We are interested in hearing from you throughout the presentation, so feel free to jump in with questions. You can put them in the chat feature, and either Quincy or I will read those out. Interactive is always better for us, so would love to hear from you. I guess our first question to the audience today would be if any of you are caregivers or if you know any caregivers. Feel free to chat with us and tell us kind of your own experiences there. It's always good to hear from the people themselves who are providing these very necessary services. And with that in mind, I would love to turn it over to Lisa and to Karina. They have been working very hard on the newest, release of caregiver results. And so Lisa, maybe you could tell us a little bit about the study that you guys have been working on.
Yeah, thanks. Yeah. Hi, Karen. I see your chat. This is, we're going to talk a little bit today about some of our favorite findings, so to speak, from Caregiving in the US 2020, which is the national study of caregivers. It is really sponsored and led, spearhead by National Alliance for Caregiving and AARP. This is, I think, the fifth study. It started back in 1997. Greenwald Research, we've had the pleasure of being involved with this particular project since 2009. So this is our third cycle. And really, this is a huge effort to understand, first, the prevalence of caregiving in the United States, and then second, what is that experience like for caregivers and what kinds of challenges and support needs do they have? Just want to start with a very basic definition of caregiving. Caregivers are unpaid. They are providing care to someone, a family member, a friend, a neighbor, who needs help taking care of themselves for some reason. It could be a medical condition, it could be an emotional health, mental health issue, could be a short-term illness. So it's not really a paid position, right? So we're not talking about home health care workers here. We are talking about just normal everyday folks. And Gail Hunt, who founded the National Alliance for Caregiving, always likes to say that if you are not currently a caregiver, you likely will be, or you will know someone who's a caregiver, or you will need care at some point in your life. So it really is something that many of us face. I want to point out that this particular study, while it was released in, I think it was back in May or June, sorry, the time is folding in on itself for 2020, that this particular study and the effort, the data that we're talking about today was fielded in 2019 before the outbreak of the COVID-19 pandemic. And I want you to keep that in mind as we go over the results today. That's really critically important. The particular study that we're going to talk about today collected data about caregivers who are caring for children under age 18 that have a special need of some sort, over and above sort of care for a typical child of a particular age. But it also had caregivers of adults age 18 and older. And those are the results that we're going to focus on today. So we can go to the next slide and talk a little bit about prevalence. So since this is the second time that we have done this since 2015 with the same exact methodology, what we were able to do here for 2020 is understand how many caregivers there are in the United States and how much that has grown over the past 5 years. And the number of caregivers in this country has grown significantly since 2015. There are about 53 million caregivers, unpaid caregivers in the United States, and this was before the COVID-19 pandemic. 48 million or so of those are caring for someone 18 and older. So it's really a pervasive and widespread role that many Americans are playing for their family and friends. Who are caregivers? They're you and me. They're normal people, right? Broadly speaking, they look like the United States writ large. They are all genders, all races and ethnicities. Caregiving spans the lifespan. There are 18-year-olds who are helping, their elderly neighbor with household chores, yard work, taking them to appointments. There are, 54-year-old women caring for their aging parent. There are husbands caring for wives with cancer. It's really runs the gamut. And, obviously, given, demographics in terms of illnesses, most of the caregivers are caring for someone older, and most of the caregivers are older themselves. But I think it really is important to think very broadly about the variety of caregiving situations that we may see. So we can talk a little bit fairly quickly about what caregivers do on the next slide. Yep. So in a typical week, caregivers are providing about 24 hours of unpaid care. So that's a little over sort of a part-time job. Carrie, hi, great. Thanks for sharing. There's some really interesting results about children, but we're not going to go over that today in this presentation, but I encourage you to look out for that because that will be coming on the National Alliance for Caregiving website. And just so everyone knows, I encourage you to go to the National Alliance for Caregiving site and download the full report. It is 100 and some pages long, I'm sorry. But if you do search for a keyword, if there's a particular group you're interested in, let's say African-American caregivers, go ahead and search in that PDF for that keyword and you'll find all kinds of interesting results. Sorry, so I'm gonna get back to, so 24 hours of care a week. And most of the caregivers are doing an ADL. ADLs are activities of daily living. These are standard, a standard rubric or set of tasks that researchers have come up with to understand what people are helping with. They're very personal and hands-on, getting in and out of beds and chairs, helping someone get dressed. And also IADLs, which are sort of helping with housework, preparing meals, that kind of thing. So really almost all caregivers are helping with IADLs. So just sort of keeping that in mind when we think about what caregivers are doing for their friends and family members, it really is quite a bit of time that they're spending and a variety of tasks.
Yeah, thanks, Lisa. So as Lisa just explained, caregivers are taking on a lot and they're doing a lot with providing over a part-time job worth of care and helping the recipient with ADLs and IADLs. So it's not shocking that all of this work and the care that they're providing has an effect on the caregiver themselves, and more specifically, the caregiver health. So what we found was that about 1 in 5 caregivers report that they're in fair or poor health, and nearly a quarter say that caregiving actually made their health worse. And I think that this link between caregiving and health declines is important because while we often focus on what the caregiver does in reference to the care recipient and the level of care that they're providing, it's easy to overlook how that kind of manifests itself in the caregiver. And again, when we're looking at the amount of care that they're providing and the activities that they help with, it's again not surprising that nearly a quarter find it difficult to take care of their own health. So if we're looking at this from the perspective of a caregiver, and I know a couple of you have already chimed in, like let's say you're caring for your mother with Alzheimer's, or your spouse who might not be mobile due to an illness or an accident of some sort, it's likely just not a priority or maybe not top of mind to, let's say, eat healthy or work out or focus on minimizing the stress in your life. And on this next slide, we'll see that stress is a real problem for caregivers, with over a third reporting that they experience a high level of stress on top of the physical strain that can kind of come along with caregiving. And as Lisa said, we know that caregiving is a diverse experience and everyone has a unique perspective. And we do have scenarios in which, again, a neighbor is taking care of another neighbor and helping with essential tasks. But again, if we're using this example of someone, a caregiver caring for a parent who's deteriorating over time due to Alzheimer's, or your spouse who's battling cancer, or even a caregiver who's seeing their child or their adult child struggle with substance use, this emotional toll that caregivers experience can be pretty great. And on top of this, it seems like the experience of caregiving sometimes can be relatively isolating for the caregivers, with a lot of them feeling alone in their role. And what I find interesting is that younger caregivers actually experience a higher level of emotional stress than older caregivers. And I think that'll be one of those things to watch for future trends, because we already know that millennials and Gen Zers experience higher levels of depression and anxiety and burnout and the loneliness, and are seeing their physical and mental health decline at a faster rate than Gen X are as they age. So I think as millennials and Gen Xers kind of grow into that role as caregivers, it'll be interesting to see how this trend of caregiver health kind of shifts and kind of shakes out in the future.
So what I find really interesting about that is that it's almost like being a caregiver is its own, category that should be included in social determinants of health when we look at that as a flag. So, health companies, insurance companies, even employers, when they look at their constituents, it seems like it'd be good for them to know if their constituents are caregivers. I know at Greenwald, we are really focused on that intersection of health and wealth. Karina, are there other tolls that caregivers take on that are maybe more on the financial side?
Definitely. I mean, it's not just health impacts. We're seeing that caregivers are impacted financially by their role. So in this next slide, I find it interesting because when we're looking at this slide, it seems like there's kind of a disconnect between the caregiver's own experience and perception of their financial situation and how that actually shakes out in the real world. So like we see on the slide, only about 1 in 5 caregivers report high financial strain due to caregiving. But interestingly, on the flip side, when looking at the number of financial impacts that caregivers have actually experienced, this 18% seems relatively low, because we're seeing that nearly half of caregivers have experienced a financial impact, and over a third have experienced 2 or more financial impacts. Mm-hmm. And like we see on the slide, the top culprits kind of where people tend to cut back in order to balance the cost of caregiving are related to savings and debt. So having to stop saving or taking on more debt or using up short-term savings, we can think about this kind of more long-term as well. And we're seeing that roughly 1 in 10 caregivers have used up long-term savings like retirement and education funds to pay for other things, or even put off when they plan to retire, or even further decided to never retire. And what really stands out to me is that, again, 1 in 10 caregivers have been unable to afford basic expenses like food. And that number seems a little like nebulous. So to put that more into perspective, that translates into roughly 6 million caregivers who haven't been able to afford basic expenses like food. And to me, it's really shocking because we're talking about the caregiving situation, right? So we're talking about a caregiver who's providing care to someone else, but can't afford to put food on the table. So again, just as a reminder, I saw someone chimed in earlier as well. The survey was conducted before the COVID-19 pandemic. So in 2019. So if we're looking at this in terms of COVID-19, these trends are probably only getting worse. And we're not only seeing high rates of joblessness, but we're also seeing that a majority of Americans are dipping into their savings, or a lot of them have already depleted their savings. So you can really only imagine what caregivers are going through right now, and how this is likely only getting worse for them because they were experiencing these things long before the COVID-19 pandemic hit and when the economy was doing relatively well.
I'm glad you mentioned COVID, Karina, because that does stick out to me. And I see Carrie also mentioned, the social feelings and the emotional feelings that have come out of COVID. The financial stresses are also coming out. we're seeing that in all of our other research as well, even to, how HSAs are being used. People are more likely to see their HSA as a spending account these days than they did even a year ago. So there are, I think, a lot of steps people are taking just to get by. But you're right, when you're a caregiver, that is just magnified and multiplied, really, those impacts. Lisa, maybe you could talk a little bit about what employers are doing and the impact for employees as a caregiver.
Yeah, I mean, I think, so here we are, right, on Zoom, all from our homes. And you think about caregivers, right? So we're juggling home life and work life, right? Daughter's sitting over here playing Minecraft on the other device. I'm sitting here talking to you all on Zoom. But then you layer in this idea that there are, 48 million caregivers out there in this country, and 60% of them work while providing unpaid care to a family member or a friend. And so then they have a whole nother sort of role to juggle in this pandemic. So it really, when I think about this data and what we see in the data is that caregivers really sort of juggle multiple roles pre-pandemic, and they sort of short certain things depending on where the biggest need is, frankly. We know from the research that a lot of our caregivers who work have work impacts, things like leaving early, going in late, taking a leave of absence, turning down a promotion. And we also know that about only half of employers actually know that their employee is a caregiver. And so it's not shown on this slide, but we did some dig-ins in the report about the benefits that people have at work, things like flexible work hours, paid leave. And when caregivers are offered those kinds of things, they are less likely to leave or opt out of the workforce entirely. So giving up work entirely, retiring early, taking a leave of absence, those kinds of big job disruptions are less common when caregivers have benefits available to them. So if you are an employer, I'm sort of putting on my employer hat, I think it comes back to that idea of knowing that an employee is a caregiver allows maybe some support, some benefits that I can offer to sort of prevent a total job loss for someone because, they're forced to make a really hard decision about prioritizing the care for their loved one over, sort of their income stream through work. So I think that's a really important thing to grapple with as an employer. I mean, the caregivers who work, so the employee caregivers, they're working full-time jobs on average about 36 hours a week. So, these are real conversations that caregivers are having before the pandemic about, do I keep working or do I quit so I can provide more hours of care? And, do I need to move mom into the home so it's easier for me to work and provide care? So I think these are real issues that employers, I think, are realizing their workforce is facing and are trying to come up with some creative solutions to deal with.
What's really interesting is, this is the trend that's not going away, right? The trend to move people from a kind of a home, a non-home care setting to the home has been going on for a long time now, especially as we've been looking for cheaper ways to take care of people as they age. And so it's interesting to see that alongside COVID and knowing that all of these results are even before COVID, this movement towards bringing people into the home setting for care, that has got to be more stressful for the caregivers themselves. Do we have any data on that, Lisa?
Yeah. So on this slide, you can see a couple of points that I think are relevant for this. Our caregivers are not just air quotes, helping with, getting someone in and out of beds and chairs or providing, like feeding someone or, cleaning and, making meals. They're actually about 6 in 10, 58%, are doing very skilled technical nursing tasks, things like IV and port maintenance, colostomy bag, issues, dealing with incontinence, checking blood sugar, blood pressure, monitoring vitals. I mean, these are things that are known in the literature for caregiving as medical nursing tasks. They are things that traditionally a trained nurse or medical professional might do. And so now unpaid caregivers, family members, are taking on those tasks. And so you think about that context of a caregiver sort of taking on that task. And in the 2015 survey, we saw that the vast majority of caregivers who take on medical nursing tasks get no training on that task before they have to do it. So you have that happening. And as you shift more care into home, you're asking family caregivers and unpaid caregivers to do more. But then you have this other trend where we saw in 2020, a lot more caregivers are interested in having respite services. So someone to come in, give me a break, let me, take an hour to shower, I don't know, go to the grocery store, just get a break from providing care for, I don't know, my adult son who has depression or something. So there's an increased need for respite services, but we are not seeing a lot of caregivers use respite services, only about 14%. So, there's a variety of barriers there. The report goes into that a little bit more, cost barriers, access issues, a question of whether or not they feel like it's right to have someone else take care of it. So that's a big issue, is sort of you're dealing with, okay, let's shift care into the home. I've got to do a whole bunch more technical tasks. I need a break, but I can't get one. So I think it puts a lot on the caregiver. And we know from the data, and this is in the report, that when caregivers have their care recipient, the person they're providing care to, in their home, they have a lot more stuff going on, basically. They're providing more hours of care every week. They're doing a lot more tasks. They have higher stress levels. They feel more alone, greater financial strain. So there's a whole sort of ripple effect on the caregiver when we talk about this trend that's happening with, Medicare and, some of the sort of funding models for care provision, but also in terms of COVID, right? When you move a recipient into someone's home, it really kind of can ripple out and affect the caregiver and the entire household.
Yeah, that's very interesting, because I think it's often looked at, the cost of healthcare is often looked at from the provider's point of view, the insurer's point of view, the healthcare system's point of view. And yes, we might be saving them money by moving people home, but is that really the right thing to do? And are we really just shifting burden to somebody who doesn't even have the resources that the health system does? And is that being done in an appropriate way?
And kind of just to chime in as well, I think that those are all great points, Lisa. And on this, just to quickly talk about on this next slide, I think it's also important to note, with kind of thinking about this shift of care to the home, is how do we support caregivers, right? We know that they're doing a lot and that they're taking on a lot. And what I find really shocking is that in reality, very few caregivers are having conversations with providers like doctors, nurses, or social workers. And as we already saw previously, caregivers are experiencing declines in their own health as a result of caregiving and struggling with stress. So how do we even start to figure out how to support them if one of their main points of contact, and where a lot of caregivers actually turn to, aren't having these conversations with them about what they need to care for their care recipient and what they need to care for themselves. And I think, Edna, you kind of already touched on this earlier, but I think that this is definitely a point along the caregiving journey where I think health insurers really can be innovative with their approach to their members who are caregivers. We already have this concept of value-based care where doctors are incentivized to provide care that's efficient and effective. But how can providers provide that valuable care when they aren't having these conversations, right? So I think that for insurers, there's a way to step in here and make sure they're pushing their providers to have these conversations early on so that the declines that caregivers are experiencing maybe aren't as drastic down the line. And even thinking further along, how can a caregiver provide the best care to their recipient if they don't know how or aren't caring for themselves, right? So I think it's a little bit of a feedback loop in terms of if a caregiver is able to talk with their provider about what they need to care for themselves and what they need to care for their recipient, this could mean better outcomes, not only for the caregiver, but for the care recipient as well. So I definitely think it's something that insurers need to focus on and should see as an opportunity kind of to step in and step up for their members.
Lisa, my other question was going to be about demos, and it looks like Karen got there ahead of me, asking about some of the breakdown of who caregivers are, and maybe you could also just touch on some of the cultural aspects. You know, do they feel like they have a choice, that sort of thing?
Yeah. So the age breakout is on average they're 49 years old. No real change since 2015. 24% are 18 to 34. So I know we tend to think about, older people being caregivers, but there are a fair amount of Gen Z and millennial caregivers. 23% are 35 to 49 years old. 35% are 50 to 64. 12% are 65 to 74, and 7% are age 75 or older. So there is a fair proportion that are, sort of quite old in providing care. In terms of, I think you asked about their working status. I don't have that off the top of my head, but I can pull that for you. And then, there's so many cultural aspects of this. The report has a lot of great data about, Asian American, Hispanic American, African American. We dove into those three groups. But one thing we found in the 2015 report that I'll mention it, and we saw it again in the 2020 report, is that when caregivers feel like they had no choice in providing care, right? That they tend to be, more stressed, feel more lonely, are more strained. And so when I think about in a clinical setting, if I was a provider and I have, my patient that has Alzheimer's and maybe the wife there that's sort of providing care, I might, if I would know, I could know a lot about her, the caregiver, by just asking and understanding whether or not she felt she had a choice in taking on the role of caregiver. Because then if I know that, then I know that she's probably feeling a whole lot of stress and strain, maybe doesn't have enough support around her, others to provide unpaid help or paid help. So that's sort of one thing that I think about when I think about that choice result.
And then I know we're over time, but you can throw Mike a bone here. He's interested in learning more about wounded warrior and PTSD caregivers, if we have any data on those.
Yeah, so we do know whether the caregiver themselves is a veteran, basically has served in the military. And we also know whether the recipients, the person being cared for, is a veteran and the person receiving care is a veteran. So we don't analyze that in the full report, but I believe that there may be some things coming from National Alliance for Caregiving on the veterans situation. I know we did a follow-up in 2015 about veterans and some interesting sort of differences there in terms of the caregiving situation. I'm not sure what the timeline is for the 2020 follow-up, but I'm sure that's something that's on their radar. And by the way, I will say this, National Alliance for Caregiving and AARP are very generous. Their data set, this data set, Caregiving in the US, will be publicly available in, I believe, spring 2021. So any researchers can use it. It's fully accessible. There will be, code there, so you know how to do the right analysis and use the right weights. But it will be a public use data set because they really want to encourage everyone to look into this issue.
I don't see any more questions coming up, and we are at time. Lisa did put, or Quincy put in the link to that report. Oh wait, last minute question, Karen. Do you have any insight in how proposed policy changes could come from an administration change? What policy changes would really do to affect caregivers?
So I can start on this one. We're not a policy firm, but I've had the pleasure of presenting these results on Capitol Hill with the National Alliance for Caregiving and AARP. And typically when those conversations are happening about caregiving, it is a bipartisan conversation. So both sides of the aisle tend to be interested in this issue, right? You know, cancer doesn't pick and choose red or blue states to go to. So a lot of people wind up being caregivers. So it is something that I think tends to get bipartisan support. I personally am not up to date on all the policy, advocacy and different proposals from different politicians. But I know that AARP and National Alliance for Caregiving do have some policy information, some positions that they're taking on their websites. So if that's something you're really interested in, I would encourage you to look there. Our role is kind of collect the data and report and describe sort of the situation. And then, think about the context in which caregivers are finding themselves and what support needs they might have. And then we let the policy folks that are experts take that over and sort of advocate for that.
Mm-hmm. Well, I think that's all we have for today. Feel free to email us with any questions. We're totally available. Love talking about this stuff. I think our email information, Quincy, is that somewhere available for them? They wanted it.
They might have my information.
Yeah. Or Quincy, who sent the Zoom invite, you can reply to her.
Yeah, we could also throw it in the chat here. But yeah, thank you so much for joining us today. It was really fun and really happy to get this much participation.
It was good to see some friendly faces and some new names. So thanks for joining. I hope everyone has a great weekend.